Hello everyone and welcome to What is Wellness? I am Dr. Adam Seay. It's good to see you and thank you for watching this video. I'm going to really dive into what wellness truly is. Many of us have our own definition of it, but a lot of times we don't fully understand it. So I'm going to go over what I do in my office to help you be well and to stay well, not only yourself but also for your family. Let's look at the definition of what wellness is. The medical definition is the quality or state of being in good health, especially as an actively sought goal. So you have to pursue this. This isn't something that's inherently to us. We have to fight for it, we have to earn it, and we have to continually do things in order to achieve it. Medicine tells us that wellness care includes regular checkups, vaccinations, screenings, exercise, and diet. Well, I agree with some of that. Some of that I actually do not agree with, and we'll go into that more later on. My definition is immensely different, again, from medicine's definition of what wellness is. Wellness to me is being in the state of optimal neurologic function with the ability to adapt adequately to continuous stressors without impairing physiologic function. So it means we have to be able to adapt to our environment, change, and actually not stress the body, not to change any physiologic output. So to me, that is what wellness truly is. We all face stressors every day and we cannot avoid them. Our stressors have physiologic impact on us, and the ability to return to a baseline is important at maintaining that homeostasis or maintaining a baseline. So when we get stressed, we got to come back to a baseline or back to homeostasis. Anytime that we do not do that, that is bad. So we lose the ability to return to that normal baseline. We begin this abnormal neurologic pattern, and that's what we'll discuss a little bit more as well. The nervous system controls every aspect of your body and integrates all the systems in your body. And in order to maintain optimization, your brain must receive fuel and it must receive activation. Fuel is going to be in the form of oxygen and glucose, and activation comes from your pathways in the nervous system firing correctly. Not firing correctly. So the abnormal activation and fuel can be detected and it can be measured, and we do it in the office. And it's a simple way to do it, and it's overlooked by many doctors. So my definition again continued. This is what to me wellness care consists of. It consists of chiropractic care, dressing your nervous system. We do recommend exercise. Exercise is important, but we want you exercising correctly, not incorrectly. We want good nutrition. We want nutritional support because you have to supplement today in today's environment and everything that we're exposed to. Our food is not real food anymore. We have to supplement. We need to look at our posture. Our posture is a gateway to the nervous system. We get our early detection of how the brain's doing by checking your posture. We want to detoxify, and we also want to provide any emotional or spiritual support because we are emotional and spiritual beings as well. Chiropractic is defined as the science, art, and philosophy of locating and facilitating the reduction of interference to the neuro-based allostatic responses of the body. So again, that homeostasis of how those responses are occurring. The purpose of chiropractic is to restore and preserve optimal health. So again, we want to remove any interference in the nervous system, get it back to its baseline, and that is the essence of chiropractic. Its basic principle, which is the body's innate recuperative power, is controlled by your nervous system. Again, we've stated that. Of particular focus is the relationship between the structural balance and the neurologic function. Chiropractic labels this interference as subluxation, or kind of another term that's hitting the market is what's called dyskinesis. So just another fancy term for this interference that gets into the nervous system that prevents it from doing what it's supposed to do. The CCP guidelines, which is the Chiropractic Council on this, actually says that subluxation is a neurological imbalance or distortion in the body associated with adverse physiologic responses and or structural changes which may become persistent and progressive. So we see what this is setting up. This is not something that just comes and goes as a one-time thing. It's persistent and it's progressive. The most frequent site for the chiropractic correction of the subluxation is via the vertebral column. Another term for this, again, that I mentioned earlier, is what's called dyskinesis. And dyskinesis stands for the dys is abnormal or impaired, and ponos being effort, work, or energy. So this definition is a reversible pathophysiologic state consisting of unnoticed, misdirected neurophysiologic reactions to various agents. Can be environmental, can be body sensations, emotions, and thoughts. So all these things impact the way that the brain can function and fire, and it's misdirected. So these errors in energy expenditure, which are capable of producing functional disorders, consist mainly of covert errors in action potential outputs from the motor and premotor areas of the cortex and the consequences of that input. So in other words, what we're saying, because I know there's a lot to take in, it's a very scientific term, I'm going to break this down for you really easy into simplistic terms, even though it's a very complex process. So if we get noxious or bad neurologic input, guess what's going to happen? We're going to get bad or aberrant motor output. So garbage in equals garbage out. So what happens? Where do we get this garbage or this junk or this mess that we get into from? It's going to be from trauma. We can see it from toxins. We can see it from our thoughts. And even the spiritual realm can come in and mess with us as well, because we are interwoven together. What does that affect? Well, it affects your posture. It affects the ability to squat correctly. It affects your balance. It affects your muscle tone. Have you ever seen anybody who's having a bad day and you take one glance at them, you say, you're having a bad day. I can tell. I can see it in your face. I can see it in your posture. You're hunched over. You're slouching. You're down and out. I can see it. And that's because you've got bad garbage coming in. You're going to get garbage coming out. Simplistic term that we can use to just kind of pull this all together for you. So the chiropractic adjustment is how we correct the subluxation, how we correct this dyskinesis. The adjustment is a chiropractic procedure whereby the consequence of an action to continually modify further action within the nervous system with the intent of creating harmony within the body system. So what we're doing is we're repatterning your nervous system. We're changing the ability of the nervous system to function and to fire. That's all we're doing. We're removing interference, allowing your brain to get activation. This adjustment is a stimulation of the posterior mechanical facet joints of the spine, usually via hand. It can be done by instrument or table. And this stimulation of proprioceptors fires into the central nervous system to maintain the integrative state of the nervous system. So again, homeostasis. Again, your brain has to have function and activation coming to it. So what kind of keeps it healthy? It's like that old adage, if you don't use it, you lose it. So if you're not getting adequate stimulation to the nervous system, function starts to go down. So let's look at a paradigm shift. If I was to ask you, how do you prevent tooth decay? Most elementary school kids can tell you that. It's a simple answer. Children know the answer to it. You got to brush, floss, and cleanings. They know it. So what if I told you that your perception of chiropractic has been completely wrong? You think of it, back pain, neck pain, I go when I'm hurting, that's it. That's all chiropractic is about. Back and neck pain doctors, right? It's far more than that. There's a huge similarity of chiropractic and dentistry, and we're going to go over this. Let's look at what dentistry's model is. The dental model, they want to prevent. They tell you, hey, we found if we prevent cavities, it restores so much more. We can do so much more in keeping your teeth, the teeth that you have, rather than going through all these expensive things, causing all this pain. Let's prevent it. So what do? They have you brush, they have you floss, and they have you do cleanings. Kids know this. Let's look at the next step that they do. They look at restoring the teeth. And this is usually asymptomatic people. So what happens when your teeth are crowding? They're going to send you to the orthodontist. Hey, this is just a cosmetic issue. Doesn't affect your ability to chew, doesn't affect your ability to consume food. It's just more for cosmetic purposes. Also, we see cosmetic things. If you've got a baby tooth that is hanging in there and the adult molar or adult tooth can't come in, they've got to make some alterations to get that to come down. It's cosmetic. It has nothing to do. There's no pain associated with it. They also want to preserve, so they want to do a lifetime of maintenance to preserve your teeth, to keep your teeth as long as you can if you're able to do that. And then they'll take on some acute care as well. So they have people that are symptomatic. There's cavities, there's pain, there's fillings, there's abscesses, there's all these things that come in, but that's not the majority of what they do. Majority of what they do, and they found, is this preventative model works very well to keep people healthy, keep their teeth healthy. So let's look at the chiropractic model. Our goal is the same. We want to prevent. We want to keep a balanced central nervous system. We want to do any structure-based x-rays if we need to. We'll do posture, and we'll do exercise to keep and preserve and prevent the body from going any further down a bad path. We want to do restoration. Again, balanced central nervous system. We want to do any functional mobility, strengthening, balancing, keeping the nervous system healthy and restoring that. Also want to do preservation. Same thing, balanced central nervous system by adjusting the spine, keeping it balanced. We want to improve mobility. We also want to improve muscle flexibility and balance as well. So again, we've got to affect everything that feeds the nervous system. Your joints and your muscles feed the nervous system. And then occasionally we see those acute cases where we have trauma, we have flare-ups, we have retracing, things that the person is going back through again as they go through the healing process. Things will flare up. We understand that. But that's not the focus of us, of our profession. Chiropractic focuses on prevention, restoration, and preservation more than we ever do acute. So again, you see the similarities between dentistry, yet so many people do not see a chiropractor. And this is part of the issues that we've been teaching and telling people the wrong. We've been telling them, hey, here, when we should be up here, hitting these other three. And this is what wellness care is truly about. So looking at these two women, they're both 83 years old. This is a colleague that showed us at a seminar. This is a patient of his, and we look at it and say, okay, both of these women are 83. Which one do you think is healthier? I mean, just by glancing at them, I want to be this person. I don't want to be this lady. I want to be this person when I'm 83, upright, looking healthy, versus this person who doesn't look healthy. So again, the big question is, which one do you want to be? And it's a simple issue, a fact of most everybody's going to select here, this lady, because we want to keep the nervous system healthy. She has a much better posture. That means she is taking care of herself structurally and neurologically to maintain this posture. This is not a maintenance posture. This is something that is degrading or degenerating. So why would you visit a chiropractor to begin with? Well, there's several things that'll push people into chiropractic. Pain, obviously, is a great motivator. Posture, they say, hey, I don't like the way I look. I'm seeing these shoulder imbalances, or I'm hunching forward. I need to work on some correction. There can be certain neurologic patterns that people get into, and we'll go over that a little bit more. Fatigue, poor health. It can be named conditions that are chronic, like I have lupus, I have rheumatoid arthritis, I have Lyme disease. All of these things that push people into a chronic condition also be helped by chiropractic. Overweight, if you want to increase performance, such as your sporting event, to prevent injury, those things are all great things to kind of push people into chiropractic. Digestive issues, just to name a few. There's so much more that, again, if we focus on and work on the one system that coordinates and controls all the systems in your body, we'll see changes happening to the person. So let's look at these patterns. Patterns that we mentioned earlier are a result of the following. They can be from trauma. They can be from toxins, thoughts, it can be infection, chronic infection. We mentioned Lyme disease. Lyme disease is a big one that we see in people. This thing is running rampant. It is a chronic infection that creates a neurologic pattern in people that throws off their nervous system. There's a lot you have to do in these cases, not just treating them structurally. You got to pull in some other stuff as well, but that's for a different lecture. Food sensitivities as well, harmful electromagnetic field. Not every electromagnetic field is harmful, but there are certain ones that we're subject to, that we've been being bombarded with, that are making it harmful for us. And then you can also have nutritional deficiencies, and most people out there have nutritional deficiencies, they just don't know that they have them. So these are the patterns they get in. So what in the world do I do? Well, I kind of do the 3 I's. We identify the cause. So the cause of your interference, through x-rays, we may do functional movement evaluation, we'll look at posture, spinal integrity, we'll look at nutritional deficiencies, we'll look at toxins, we'll look at your ability to detoxify. We combine this metabolic approach as well to influencing the nervous system. The next thing we do is we want to interrupt. We want to interrupt the pattern that you're in through adjusting, through dietary changes, nutritional support, functional rehab, lifestyle modification, etc. We want to address and interrupt the current pattern you're going down and change that. The other one is we want to implement. We want to implement a treatment plan that's designed to help you succeed in reaching your health goals and reaching wellness. This is ultimately what it's about. We won't want to put a Band-Aid on you and send you on somewhere else and say you're good. We want to get to the heart of your problem. We want to correct that, and then not only get you beyond your pain and your discomfort that brought you in, but get you back to wellness, get you into, a place of health and healing. So my goals for my patients: one, we want to relieve pain. That's ultimately what everybody comes in. If they're motivating pain, that's our first focus. We want to get you out of pain. We don't want you hurting. We want you to get you better and get you some relief. The next thing is we want to break those old patterns. Again, breaking through and interfering with those things that have got you to, number one, giving you pain to begin with. The next thing we want to do is we want to increase your ability to adapt. Again, our nervous system has to adapt to the environment that we place it in, and if you're adapting poorly, you're going to have poor output as a result of that. So we've got to get this ability to adapt better. We also want to correct any nutritional deficiencies that are there. The usage of Roundup is rampant in our society. They're spraying our crops with this stuff, MSG. I mean, all these things end up in food additives in our food. Our food is not real anymore. So if we go and we eat, food that we think, hey, this is conventional, but it's a fruit or a vegetable. Yes, those things are helpful, but the problem with that comes into if they're exposed to Roundup, it's chelator. It's going to chelate your nutrients, it's going to chelate your vitamins out of that food. So you go in and you eat something that has vitamin C, it has B6, it has manganese, it has magnesium, all those things that are so helpful, and you consume that, this chelator comes in and pulls all of that out of your body. So then now you think, I'm getting all my nutrition from my food, yet your food is depleting your body. And we see it countless times in my patients. I'm telling you, this is a must. We have to correct nutritional deficiencies. We have to supplement nowadays. The last one, next to the last one we want to look at is to improve detoxification. We want to get to your body to detoxify because, again, our environment is so toxic. We're exposed to chemicals every day. No one can avoid them. We have to remove them and allow the body to adapt the best it can to the environment we're in. And last but not least, we want to balance any harmful EMF. We can't avoid this either. EMF is everywhere. We're not going to be able to avoid it completely, but we want the body to be a little bit more balanced in that type of environment. So let's look at the three systems in the nervous system. Not to go too detailed into all this, but there are three systems. There's the passive system, there's an active system, and then there's a control system. So your passive system is going to be those things that don't move, or move, but they have to require things to help them move, like your bones and your joints. Your active system is going to be your muscles. That's going to move us around. And your control system is going to be your nervous system. That coordinates and controls everything in the body. So if we look outside of this circle, and the gray are going to be things we cannot avoid. Stress, we can't avoid it. It's everywhere. We can't avoid emotions. We're all subject to this. We all have emotional stress, emotional traumas. Genetics play a role in this too. We can't change our DNA, at least from what mom and dad gave us. We can based on the environment we put it in, but some things are, what we're handed down from mom and dad. We can't remove the electromagnetic field completely, at least currently. So these are stressors that are always around us. Toxins are always around us, and we're all subject to trauma. It's things that we cannot avoid. So based on that, these things affect the bones and the joints, they affect your muscles, and they affect the operating system. And that operating system is going to be your autonomic nervous system. It's things you don't have to think about: your blood pressure, your respiration, your digestion, your reproduction, your immune system, sleep. All those things are done by the operating system. So all these things are influenced by those stressors on the outside of the circle. Now, if we go inside of that, this is kind of what we look at to correct things for people. So we want to look at your posture. If you have poor posture, that's going to influence, your ability for everything in the body to work, your operating system and everything. If you're not moving correctly, it affects the operating system, it affects muscles and joints as well. And then if your nutrition is poor, it's going to affect those things as well. So all of these are integrated by the nervous system, and that's the system that we go after. So when we deliver an adjustment, we're not only affecting posture and affecting movement, we're changing the nervous system, and ultimately when we change nutrition, we also have that impact as well. So you see just the benefits that these have. So this is why we take this holistic, multifocal approach, because we can't just treat you, where you are as a static person and just look at you with, this, monocular vision. We have have to look at it, from a whole expansive viewpoint, looking at you holistically, integrating all these other features together to influence how the nervous system works. And that's what I do in my office. We pull in this holistic approach. So let's look at some of the tools of the trade that I use in my office. We do chiropractic adjustments. We use laser, which is light therapy. It works very, very well in the nervous system. We do decompression on the spine, both the neck and the lower back. We do detoxification foot baths to help your body detoxify by driving more electrons into the body. We also use peripheral neuropathy rehabilitation therapy, what we call PNRT, to rehab your large diameter afferents, to rehab the nerve endings on your feet and your hands to get that better, to decrease pain. We also do exercise with oxygen therapy. This is a great tool to provide fuel to your nervous system. You have to have oxygen, you have to have glucose to get that fuel going to the nervous system. We also do nutrition. Big part of our practice in incorporating good nutrition and nutritional support. And we also want to do stabilizing orthotics if the need arises or we see the person's not moving correctly, there's a structural imbalance, we have to sometimes support. We also can use kinesio tape to again further enhance support, help with pain. We also use functional rehab to really get to the core problem, to get you moving better and moving correctly. We use a chi machine to drive kind of midline, but also to help lymphatics and help acupuncture meridians. We use eye lights to use it as a kind of a way to rehab the nervous system through light stimulation. We do different miscellaneous home devices that you can use to help correct some of your posture as well. And then we incorporate this whole metabolic side, which is laboratory testing, functional medicine, going through all these things to really get at the heart of it. So we do see all sorts of people in my office, not just neck and back pain, but we see, again, chronic infections, we see Lyme disease, we see people with autoimmune diseases, thyroid problems, digestive issues, all these things that we integrate together to really give your body the best chance it has to achieve wellness. I truly believe each person can get to some degree of improvement and get their body moving in the right direction toward wellness. So for treatment, I always use this quote with patients. We say the patient must combat the disease along with the physician. This isn't on me completely. We have to come and meet halfway. It's a mutual decision that you and I both have to come to fight this, to fight the disease process and get you moving in the right direction. Results are not guaranteed. They are earned by those willing to work alongside the doctor. So if you're willing to come in, I'm gonna do everything in my power to help you get well and to put you on the path to wellness. You have to meet me halfway and come as well. Most people need more care over a longer period of time to achieve a healthy adaptive nervous system. So again, back to our original definitions, it's an active sought goal. You have to actively seek this. This isn't something that just turns around overnight. It requires time, effort, and energy. Pain relief does come quickly. So we tell people, hey, look, you're going to probably be out of pain faster than we anticipate. This is going to feel like, hey, I'm good. I don't need to continue to do anything else. But I'm telling you, if you want to correct the issue, you have to put in the work to do it. You need to attach yourself to the process, not the outcome. The outcome you desire is the result of the process. So if you put the time and effort into it, you're going to reap the benefits of what that time and effort has done for you. I would love to help you start your journey to wellness care. I really do. This is a passion of mine. I really want to help people. In summary, I want to kind of go back through what we did because I gave you a ton of information. I want to kind of hit the highlights again. Again, your nervous system is the most vital system in your body, and it requires you to provide fuel and activation for it to work properly. Again, fuel, oxygen and glucose, activation, pathways firing correctly. You're moving correctly, posture looks good. You're not having those issues for improper or noxious stimulation coming in. You're actually able to take it back to a baseline where it then performs the same way that it did even in lieu of what it came into contact with. A dysfunctional nervous system is seen in postural alterations, in movement dysfunction, in unbalanced muscle tone, poor sensory ability, and an unstable balance. So we test these things in my office to see how well is your nervous system adapting to the environment we're putting it in. And if we find there's not a good adaptability, we got to work on it. We got to work on getting you back to where it needs to be. To obtain wellness, one must address exactly what the nervous system requires to be healthy. Chiropractic integrates all the requirements for a healthy nervous system as mentioned previously. So I want to give you an exclusive offer for watching this video. I know we've gone over so much information, but I would like to extend to you an offer for an evaluation of your nervous system, doing a postural screen, functional squat test. We do, so many orthopedic neurologic tests. We test all these things. We see how well your body can move and assess this for you. And I'm willing to do this for $47. I have a link included. If you want to click on it below, you can. It'll take you to a coupon. You can print that coupon off. You can bring it into our office. You can also call my office today if you want. Just say, hey, I watched the video. I didn't click the link to get the coupon. I want to get in right now. Call my office right now at 919-662-0520. I really look forward to helping you. I always tell people our waiver, if you decide to do this and not read the waiver on our coupon, if you decide to purchase additional treatment, you have the legal right to change your mind within 3 days and receive a full refund. By law, Medicare is excluded from this offer, and this is an $85 value that you have. So again, I look forward to helping you. I look forward to seeing you in my office. Thank you for watching this video. Take care.